Hello, everyone. No, not yet. Sorry. Did you, Joel, did you do something? I cannot see the wait participants anymore. Can you let them in? Okay. Hello, everyone. Thank you for joining. I see people are trickling in. Hello, hello. Welcome to this Friday Forum. We have a wonderful forum for you. Thank you all for joining. I see that people are still popping in and connecting. Please, hello, hello, hello. Thank you for joining, everyone. We are recording and we are live streaming on YouTube. And everyone who's joining us live right now, thank you for being with us. Welcome to this TBPPM Forum, which we're doing with the union today. We are honored to co-host with the union, the nurses and allied professionals. And I'm very soon going to hand over to Fernando to talk a little bit about that. Today, we're talking about nurses and the important role of nurses in our work on caring for people with TB. And how can we best equip, engage, empower, and protect nurses to end TB? In our last Friday Forum, we explored experiences of providers and those managing with TB programs to have access to new TB regimens. But today, we really want to see the aspect of care of those people that are affected by tuberculosis. So I'm very, very happy that we have a fantastic panel with a lot of experience in the nurses sector. Today is 2 days away from International Nurses Day. So this is a good opportunity to highlight the issue. A few logistical announcements. Please use our chat or raise your hand if you have any questions. And we can all view what you put in the chat, so we will try to answer or we will call on you. The session is being recorded and live streamed. You can also turn on subtitles if you prefer, or if there's issue with language. I'm sorry, we don't have translation. We will be sharing a news post and then with a link to the recording, including a chat with all kind of information in a report, as well as a link to the forum online where you can continue talking about the topic. So before we introduce all the panelists, I would like to ask our co-host today, Fernando Sanchez from the Union, to say a few words of welcome and to also introduce everyone. Fernando, please, the floor is yours.
Thank you very much, Petra. It's a wonderful day. We are just in the week of celebrating nurses, the International Nurses Day. From the NAPS, Nursing and Allied Professional, from the International Union Against TB and Lung Disease, the union, we are celebrating. Can you hear me? Sorry.
Yes, Fernando, go ahead. Sorry, Fernando. There was just an interruption.
I'm sorry. Yeah, thank you. So we are just celebrating this moment in the partnership that we are doing with the TBPPM community engagement from the McGill University Center. We are very happy. I hope we have a very nice moment for discussion. For the brief introduction from the union, we just released a very short report from the International Nurses Day. We can check in the union's website. We have highlighted some of the activities nurses are doing as associated in the union. And for the news, we have in November our international conference on lung disease. It will be in Bali. Everyone that is attending or will assist this webinar forward has opportunity to enjoy and read a little bit more for what represent the union conference. Thank you very much. I hope you will have time to enjoy and discuss with the attendings that we have time and share the experience from your place. So, Petra, I have to introduce every guest now. So we have today, as part of the guests, we will discuss how can we best equip, engage, and empower nurses to NTB. How is the formula or how is the path that we can just address a better experience? And also, why not share the challenge, opportunities, some barriers, and how to keep moving forward, even that obstacles that appear in our experience. Very happy to introduce Maria Smilos, Shruti Kirti, Jojo Moyo, Elias Obina, that in a soon and brief moment will be joining us, and Carrie Tudor. She will moderate us. So as our beginning, I will introduce Carrie Tudor, who we she will our moderator. Carrie Tudor is the Deputy Project Director of SMART for TB. And he has 25 years of experience in global health on various global health projects throughout Asia and Africa. Dr. Tudor. Oh, sorry, I changed the order. Oh, no. I just speak maybe a delay of my sign. I'm sorry.
Fernando, you can go a little faster. We will make sure that all the bios of everyone are online. And just
okay,
if you just have everyone's name mentioned, that's fine. We will make sure that all your profiles are fully for people to read, because we want to move along so that we get to people talking. So
thank you very much. I am enjoying this moment with my cell phone. My computer doesn't work, so it is small. So let's keep it forward in the right time.
That's so Maria, right. That's right.
No, perfect. Thank you very much. So Maria Smilos is the author of The Black Angels, the untold story of nurses who helped cure tuberculosis. It's an amazing book. I just begin to read it, and I hope everyone can enjoy this moment. So the next one, we have Jojo Moyo. Mr. Jojo Moyo, he has advanced diploma as a HIV nurse practitioner and holds an undergraduate degree in nursing. And he has worked in a sub-district TB program office under auspice of the Lusaka Provincial Health Office. The next one, it's me. So I have working with occupational and public health, master's in nursing, and I about to finish my doctoral degree in tuberculosis. Tuberculin is recombinant. So we will have news after this August. I hope share all the news information from Brazil that we are testing. The next one, Mrs. Shruti Kirti. She holds a postgraduate degree in nursing, and she will she is working the community health officer. Thank you very much for her. And the last one, Mr. Elias Obina. I don't know if he already joined us, but he worked as a nurse in Nigeria, and at the Unit Mile 4 Hospital in Abakaliki, Ebonyi State. Thank you very much. Carrie, I think the floor is yours, and Petra, please. Thank you very much.
Thank you very much, Fernando. Good morning, good afternoon, good evening, wherever you may be. It's a great pleasure for me to be here with all of you and with many of my very dear nursing friends, and Maria, an honorary nurse now. So let's get started. I'm very biased, but nurses I think are very critical, or play a critical role in the fight to end TB. And so I'm very thrilled that the TBPPM has created this forum today to talk about the role of nurses in TB care, because I think that we are very important. So what we'd like to do now is to start asking some questions of our lovely nurse panelists here. And if you have any questions, please remember that you can put them in the chat at any time, and then we'll have discussion at the end. So to get us started, to all of the panelists, so Shruti, Jojo, Elias is, I believe, still trying to join. Could you tell us all a little bit about your daily life as a nurse, and specifically your TB journey? And if you could tell the audience what makes you the most passionate about caring for people with TB and your role as a nurse in caring for people with TB. And Shruti, we can start with you if you'd like. What makes you, what's your average day like as a providing TB care as a nurse, and what makes you very, makes you passionate about that?
Yes, ma'am, yes. A warm greeting to everyone. So presently I'm serving as a community health officer for a population which covers approximately 4,000 to 5,000 at Ayushman Arogya Mandir, so which will be functioning for 8 to 9 hours. So this Ayushman Arogya Mandir was launched under umbrella of Ayushman Bharat. It is one of the central government scheme in India. So mainly for achieving the universal health coverage. So this has a vision to provide a comprehensive, affordable and accessible healthcare services to rural, urban, as well as for the tribal areas. And to provide free of healthcare services, to put it in another word, to make out-of-pocket expenditure zero, so that they get services with no cost. So this was a main vision of this Ayushman Arogya Mandir. So India has improved a lot in field of technology as well as medicine, but still tuberculosis remains a social stigma. They don't discuss openly in a community area, and they keep the patient, once they are diagnosed as a TB, very far from the community, and they don't want to know that they are TB positive. So this is still a social stigma in India. So with the hope that we maintain confidentiality, so the community people come to us for the help or for the suggestion. So we, the Ayushman Arogya Mandir team, so we render a first helping hand at the grassroots level of community. So whatever the patient or the community people, they have problem, so we are the one to whom they come. So we work at grassroots level. So this makes me more passionate to be as a community health nurse. So because we render an helping hand as it remains a social stigma. So this is my daily life as a community health officer. Thank you.
Thank you very much, Shruti. Jojo, so the same question over to you. And I know you're very passionate about the care you provide. So over to you, Jojo.
Thank you so much, Carrie. In my current job, I'm a sub-district TB program officer within Lusaka province. My role includes mentoring nurses, clinicians, and treatment supporters in the TB corners and in ART. I plan for activities like active case finding, TB strategic meetings, and different TB trainings, and also community sensitization. We're quite passionate about that. We work with the treatment supporters. They come up with plays educating the community. I also take part in evaluating performance towards targets. These are facility targets, sub-district targets, provincial and national targets through various fora throughout the week. These targets include TB presumptives, TB notification, MDR TB notification, TPT uptake, a different age, under 5s in the older population now even have 1 HP, which we're scaling up. It was introduced recently, and at least it has been received well by our clients. What makes me passionate about the role of nurses in TB is that nurses are at the forefront of TB management, because it's the nurse who spends the most time with the patient, starting from treatment to the end of treatment, and is also a confidant for these patients. So I thank you so much.
Thank you very much, Jojo. And Petra, has Elias joined yet? Or is he still trying to get connected?
He's still trying to connect, so we'll
Okay.
call him. I'll let you know when he's there.
Okay. Okay. Thank you. Sorry about that. So Jojo, I know that you've done so much with patient care and sensitizing in the community, and Shruti, you're also working in the community. And I know that for TB care, stigma is such a huge issue. Can you tell us a little bit about how you try to sensitize the communities around TB to really provide, to decrease stigma and to really improve how patients are treated, or those living with TB are treated in the community? Jojo, you first, and then Shruti.
Thank you so much. So one of the messages we try to emphasize even in our sensitization is the fact that TB is curable. And also, I think it's very important, we've made sure even in our sensitization to let people know that it's an infectious disease. So anyone can catch TB, but it can be treated and cured. So I think there's more self-stigma these days. There's a lot of self-stigma. You find that a lot of our clients who come to our facility, they actually stay very far. They leave all those facilities next to their home. They prefer to go somewhere far where nobody knows them. So I think that's, if we can go over that hurdle, it will help us with the other stigma, which is now from the public. But the public stigma, yes, it's there, but it's not so emphasized as the self-stigma. Yeah, thank you.
And Shruti, can you share a little bit with us also about how you sensitize the communities?
Yes, ma'am. So we have a weekly schedule. So every Wednesday we have outreach non-communicable disease camp. So we get a lot of people ranging from 50 to 60 members. So after conducting NCD program, we create an awareness. So we frequently talk about, yes, TB is a communicable disease, but now it is treatable with a prompt treatment. So we emphasize every week to a larger group of people in community so that they become aware. Yes, TB is not a curable disease. Yes, it is a curable disease. So if they get something like symptoms of coughing more than 2 weeks and unexplained weight loss, we tell them to come and contact us. So we create a lot of awareness in community people so that they come and they come to us freely to share their problem. So mainly we use IEC, information, education, and communication.
Perfect, thank you. And that goes a long way in decreasing stigma in the communities, and hopefully increases patients coming to the facilities to receive treatment and care. While we wait for Elias, we'll switch gears a little bit and move over to our honorary nurse, Maria Smilios, to talk a little bit about her wonderful book. If you haven't read it yet, I recommend that you go out and get it. Black Angels is amazing. And so Maria, for those of people that are not yet familiar with your work, if you could provide, you can give us a little bit of a synopsis about
Sure.
the nurses in New York in the early 1900s, 1950s, and some of the lessons that you've learned from the work that you did on your book, and how you as an outsider or honorary nurse see the role of nurses in TB care.
Absolutely. Hi, everybody. Good morning, good afternoon, good evening. Thank you for inviting me to take part in this. I just want to say I was listening to Shruti and Jojo, and so many of the things they were saying resonate with me, because even though there have been great strides in tuberculosis, stuff around stigma, stuff around self-stigma, public stigma, and people who are getting sick and the transmission of the disease resonates. This is stuff that was still happening, 80 years ago in my book, that same type of social stigma. I'm going to give you a kind of, 1 minute idea of what the book is like. The book, The Story of the Black Angels, is about a group of African-American nurses who were called up from the Jim Crow South to avert a public health crisis when white nurses at Seaview Hospital began leaving for a variety of reasons. And they started leaving in 1929. And one of the main reasons they were leaving was that they had opportunities for jobs that were not going to kill them. At the time, we all know there was no remedy for tuberculosis except fresh air and sunshine. And there were also no antibiotics. So most of the people who were being sent to this municipal sanatorium, which was on Staten Island at the time, it was not connected to New York City. Staten Island is one of the 5 boroughs, for those who are not familiar with the layout of New York, set high up on a hilltop. It was called the Pest House. It was underfunded and understaffed. And when the white nurses began leaving, the city said, we have 2 choices. We can either close the hospital down and have thousands of these patients who were mainly immigrants that had come over from Europe. They were considered uncultured, un-American, uncouth, immoral. They were blamed for the spread of tuberculosis, despite the fact that they lived in slums down in the city. There was an area called Lower East Side. There were 80,000 5-story tenements that collectively housed 2 million people. So the city decided to send them away where they were languishing and dying. So they call up these nurses, and the nurses get sent over to Seaview, and they're told to basically take care of these patients. And many of the theme, and so that sets the stage for the story that takes place, and the story unfolds and tells you how these nurses worked with these patients, what they encountered on the wards, and what they encountered outside of the wards in their community by themselves being stigmatized because they were Black women. The other population that was greatly affected by tuberculosis at the time and was dying at 3 times the rate of white people was African Americans in Harlem, who were migrating up. So you had the migrants and the immigrants bookending New York City. And then these nurses were called up. So that's a kind of big, broad overview of the book. But I'm really struck by these themes of stigma and isolation, that they are still, here we are in 2024, they continue to persist despite the fact that we know tuberculosis is curable, that we know that this is a social stigma. Back then, it really was, as I say, a scarlet letter. People would go to Seaview, their families would abandon them, children would be abandoned. I heard stories from nurses of children being orphaned and the nurses adopting them. And I say adopting them because Black women were not legally allowed to adopt children. And so they just took them home. So that kind of sets the stage for my story.
Thank you very much. And I think you've, there's a it's an article that I haven't written yet, but it's been in my head for several years. An article that was written by nurses as part of a conference, TB nurses in the US in the 40s, late 40s, I think. And the things that they describe about nursing, TB nursing care in 1947, I think it was, to today, if you took the years away, it would, it's the same, the same story keeps repeating itself. But so we still have much to do. But some of the things that you came up, and I think it's not only the stigma of the patients that those with TB feel stigma, but nurses working in TB often also feel very stigmatized. And I know nurses in China tell me that they won't tell their family that they work on the TB ward or in the TB hospital. They'll say that they work in a pulmonary hospital or the chest hospital, because they're, especially the young single nurses, are worried that their family will shun them if they know that they work with those in a TB ward, or that they'll never get married because they work in TB. So there's stigma that a lot of nurses feel about working in TB. I know, and Jojo, maybe you can have experience with this, but in many places in Africa we hear stories of the matron shunning as punishment to have nurses work in the TB ward. So, which is poor for patient care, because you get people that don't want to be there providing care. I don't know, Jojo, do you experience anything around nurses feeling stigma for working with TB?
At the moment, no. Some time back, it was like that. But what you find nowadays is like TB has a lot of opportunities. And then the other thing is that the TB corners are now well stocked with PPE. So actually, when people prefer to work in the TB corner than OPD, because what they say that when the patient comes to OPD, you don't know if the patient has TB. By the time the patient is coming to the TB corner, you know that the patient has TB, the patient has been diagnosed, and you also have this PPE, meaning the TB corner nurses are actually more protected than the OPD nurses. Apart from that, our ministry has a lot of trainings for TB nurses, so they get opportunities. Recently, there was an operational research training. So even partners have jumped in, and then all these programs. So you find that a lot of nurses want to work in TB, actually. That's what's happening currently. Yeah.
Excellent. That's a good improvement. But you bring up an important point, Jojo, about protection and nurses being having the protection that they need to work in TB or with drug-resistant TB populations. And that's wonderful to hear that Zambia is doing a lot to make sure that nurses are protected. But what do you think could be is the important aspect of making sure that we equip nurses and have nurses protected in the role of caring for those with TB?
Yeah, I think it's very important. But apart from having the equipment, I think it's very important because now we talk about having a facility, TB infection plan, a TB infection policy, the TB trainings, and facility TB infection assessments regularly. So you find that it's really this especially when you have you formulate a policy and a TB infection plan. We find management gets so much involved in TB. And then when it comes to the PPEs, actually, it's very important and cardinal. That's what I can say. But one thing I've noticed with nurses, let me say generally healthcare workers, when they spend so much time in TB corner, they kind of develop this. There's a paper by Delph et al., which was written titled "Why Healthcare Workers Are Sick of TB," and it was published in the International Journal of Infectious Diseases in 2015. It discusses a phenomenon called TB proof. And this is where someone has a heightened sense of disease among others, but a low self-perspective. And that usually happens when nurses spend a lot of time in the TB corner. I remember this paper because when I came across it, I'd been in the TB corner for 5 years and I'd realized I had this TB proof phenomenon. Yeah, so I can't forget that. But making sure you have a robust TB infection control program is actually a way to go around that. Yes, thank you.
Sorry for my clock in the background. Thank you very much, Jojo. And Shruti, the same question for you. How is the situation for nurses in India working on the front lines in terms of infection control and protection and access to PPE? You're on mute, if you can unmute yourself, sorry.
Am I audible now? So when it comes to best equipped, yes, we are best equipped with knowledge, positive attitude, and skills. We get time to time trainings on TB, infection control. Yes, in terms of knowledge, yes, we get a wonderful platform and we gain lot of knowledge. But when we come regarding engage, protect, and empowerment towards the effort to end TB, so we lack in setting up skill labs for training the nurses. So theoretically, we are very good. But when it comes to practical, so somewhere we miss out a skill. So we don't have a platform where they demonstrate a skill. So that we lack. And we are only at implementation level, execution level, but we are not a part in policy making level. So whatever they give us, yes, we do in an execution level. So there will be a lot of gap between this. So as we are not a part in policy making, so they may not know the problem what we are facing at the execution level. So if not, yes, we are best equipped.
And you have access and sufficient supply of N95s or other PPE on the front lines?
I did not get you.
Sorry, do you have access to N95 respirators and other PPE, personal protective equipment on the front lines and are able to protect yourself?
Yes, we are able to protect ourselves.
Wonderful. Because in my past life working with the International Council of Nurses in TB and training nurses globally, one of the first things that the nurses always raised as their biggest concern was the ability to protect themselves. So I think maybe COVID has also helped heighten or increase awareness about airborne infection control more broadly. But I know that that was has always been a big concern of nurses. And I see that Elias has joined us now. So sorry, Shruti, to interrupt you, but Elias, if you could just briefly give us an introduction and or introduce yourself. If you're here. And welcome. No. Hello. Oops, we can't hear you. You're not on mute, but we can't hear you. Can you hear us? No?
I think Elias might have some technical
some
difficulty.
issues. Yes, we'll come back to you, Elias, when we can hear you. Sorry. So in addition to one of the issues that I think is often being involved in global guideline development at WHO and national guideline development, one of the voices that is often missing is the voice of nurses in terms of developing national guidelines and how guidelines will be rolled out for TB care in countries. And so I'm just wondering from Shruti, Elias, when you're able to join, and Jojo, what your thoughts are on how, and if you agree with me, if about the role of nurses should be more involved in the development of guidelines at the national level. And Shruti, I see you nodding, so I'll start with you.
Yes, ma'am. A nurse who is born as a nurse with a quite of experience, she'll have an upward promotion. Sorry. Am I audible? When a nurse joins as a nurse with an experience, she gets a promotion only with limitation. So, but she'll never be a person at the administrative level. So we don't have a speak out voice at a
Oops, she muted again, sorry. Okay, you're back. So sorry, you're saying that nurses don't rise to an administrative level and don't have a voice. So we can't hear you. Sorry, Shruti. So Shruti, while you get your audio sorted, Jojo, I'll ask you that question if you have any thoughts on that.
Yes, thank you. Yeah, I do believe nurses could have bigger voice when it comes to making guidelines. They do have a voice, but it's very limited. It does not really incorporate their experience on the ground. Yeah, the good part is that whenever guidelines are out, there's trainings, everybody's trained in any tool. We have a very good system of making sure the TB corners are trained and updated on new tools and guidelines. But definitely, I think nurses need to be more involved when coming to making guidelines, especially at the national level. Yeah, that's what I'd say about that.
And how do you think we can, as a collective, become more involved at the national level?
Yeah, I think it will have to start with nursing research, because it's all about, if we have to get more involved, nowadays practice is evidence-based. And nurses, when it comes to research, they really lack. They've taken more of a role of research assistants. They mainly, you find them in participant recruitment or entering and managing data, not as principal investigators. Maybe when they're doing their BScs, MSc, that's when they do as their principal investigator. But I think if we can strengthen nursing research, then we can go to the policymakers and tell them, here is the evidence. Then nurses will definitely get a bigger stake in the formulation of guidelines.
Harry, can I just jump in a second?
Please.
I'm listening to this, and as I'm not a nurse and I don't know anything about like how policy is made, but what I could say is in my story, when the isoniazid trials happened and they were overseen on the higher level by Dr. Robachek. So for those who don't know, the first isoniazid trials took place at Seaview Hospital with 97 patients. Those trials were overseen by Dr. Robachek, but it was the nurses who administered the medication. It was the nurses who were on the front lines and made everything happen. And the reason was because they had worked with TB patients for decades. They knew the nuance of the disease. They knew how it ebbed and flowed. They knew how tuberculosis was so wily and stealth and beautifully rendered that it could turn on a dime. And all of these things they brought to the bedside. So when Robachek said to them, you need to administer this medication, and the trials had never been done on humans, so they had no data. You know, it was up to the nurses to not just take the vitals every day, but to make sure the emotional, mental, physical state of these patients. And so every day they looked at these patients, and one of the most extraordinary stories that kind of puts this into context into how astute and meticulous and important nurses were to these trials and today was that they noticed that people's legs were twitching as they slept. And that's pretty incredible because these patients were emaciated, they were cold, they were sleeping under blankets. And so to be able to see that, and at the end of the day, Robachek took this information, collated it, and then began to track, you know, based on, you know, he tallied it and he said, okay, these are what we're seeing. But he himself said, had it not been for the Black nurses, none of this would have ever happened. So you hear that and you think these women who were bedside every single day, all day long, were never involved. You know, they were told, give these people medication, and they couldn't say anything. They couldn't say it's not going to work, or this person probably shouldn't have this surgery. So when I hear that back then, you know, the person who kind of brought this drug, ushered it into the world, and you know, tuberculosis finally was able to have a cure or a remedy, the women who were responsible for doing so were silenced. And now it's still happening. So I just wanted to add that back then he had said that if it wasn't for the nurses, it wouldn't be possible. And, you know, nurses are the people who see the patients every day. They are bedside. They do know everything that happens. So it's kind of shocking as somebody who's outside to hear that they're not invited to the table to give their opinions and to give their ideas of what policies might work.
Shruti, did you want to finish what you were saying earlier about the role of nurses in guideline development before your audio cut out? And then we'll go to Elias. Shruti, did you want to finish what you were, can you hear? Did you want to finish your thought on the nurses and guidelines?
Yes, ma'am, I have said it. I suppose I have said it. The promotions are very limited. So if the promotions are to a bit higher level, then it would be better. So as we have used only in the execution level, so we would be the best person to know what problem we are facing. So if there is some voice which voice outs behalf of all the nurses at the policy level, it would be better.
And do you have any suggestions if you were in charge? Do you have suggestions on how more nurses could be elevated to those positions? And there's some gender issues around nursing. We have 3 of our nursing brothers with us here today. The sisters here are outnumbered, but there's still the doctors are male and nurses are female. And so there's that gender dynamic in many places still. But I don't know if you were in charge, what would you do to make sure that nurses were more elevated?
If I was the nurse, then I would tell them to continue their higher educations. So to do some research in which they are comfortable. So this would bring, as Sir said, it gives a lot of evidence based. So that would leave a print. Yes, nurses are involved in research and they are giving a result out of it. So somewhere we can move upward in that terms.
Thank you. And Elias, we can hear the noise in the background there now, so welcome. If you can just briefly introduce yourself to the group, and then I have a few questions that I can ask you. But welcome.
Yeah. By my name, Elias Obina, working at my 4 hospital, Abakaliki, as a dog focal person and the head of department of the dog clinic for more than 11 years. So I see patients on daily basis, but on daily basis, screen them, commence them on treatment when the genus part is out, and monitor the treatment till the patient becomes cured. Some of the passionates we have in our clinic and dog clinic is that 90% or 95% of our patients is cured, irrespective of the thousands of patients we manage in our clinic. So, and other infection controls is being followed up. Thank you.
And if you can, Elias, if you can tell us what makes you most passionate about working with those with TB and providing care for those with TB.
One of the things that makes us passionate or makes me passionate while working in TB is that most of our patients completed their treatment in the sense that our cure rate quarterly is almost 95%. That is what makes me a passionate. And sometimes it also helps us in connection to the society.
Excellent, thank you. And one of the other questions that we had was around the role that nurses can and I feel should play in the development of guidelines. And in Nigeria, how are nurses viewed, and are nurses part of the guideline development process?
Actually, in Nigeria, in terms of equipping the nurses to do very well in the practitioners, we have to train them, supportive supervision, giving them a kind of manpower so that they can able to do, because the report and recording in those clinics is much. So we need a much hands to help and document, and also provide the up-to-date national guideline that the nurses can also use when there is any confusion while managing the patient. Then in terms of engagement in the country, is very important to integrate with the other health sectors, like people managing malaria and the DM and also the HIV patient, because if it's only dog clinic that screens all the patients, it's difficult to get some of the number of the patient that is suffering from TB in the society and also the community. And it's very important to provide a motorbike that some of them can use and trace some of their patients and do proper contact tracing in order to end the TB.
Thank you. We have a few questions in the chat, but before we go to those questions, I'm just wondering if all of you would like to, all of the panelists would like to give a short takeaway message about what you think are the most important aspects of the role of nurses in the care of those with TB. And I'll start with ladies first. I'll start with you, Shruti.
Yes,
Please, can you come again? I'm not hearing what.
Sorry. We're going to I'll ask all of you to give a summary of what you think are the key takeaway messages about the role of nurses and the care of those with TB. And I'll start with Shruti first, ladies first, and then we'll come to all of you.
Okay.
Okay.
The takeaway message we can give to other nurses that in some countries or some areas, some of the nurses runs away from the dot clinic. So advice I'm giving to some of our colleagues who is the nurses is that TB is curable and is not hereditary. And if proper infection control is being done in the facility, I don't think that the nurses can contact the disease. Because I myself, I have worked in dot clinic for good 11 years and I have never had experience of cough. And I'm managing not less than 2,000-3,000 patients per annually. So I'm encouraging the nurses for them to to have an infection control committees in the facility so that they can able to so that they will not able to contact those diseases. And not even in the dot clinic. The infection control links even to the community. So there's community areas that we visited. Some of them, the way of the living, you know that they are much overcrowded. So during the sensitization, so you have to give them at least a briefly health education on how to live so that you cannot able to contact the disease. So it's curable. I'm advising other nurses, they should not be running away from TB patients because you don't know whom will suffer from the disease. Thank you.
Music to my ears, sir. Shruti, over to you.
Coming to the takeaway message on a role of nurse, yes. So we are taking up a role of educator by creating an awareness. So we are also a socialist. We are trying to erase the social stigma which is related to tuberculosis. We are also taking a role of treatment supporter. So explaining them, you should have a good adherence to the treatment and follow up. As well as we are taking a role of nutritionist, telling them to have a high amount of protein so that they can recover very fast. And we also take a role of advocate also. So we take some decision in favor of TB patient. So as a whole, yes, we are taking all this role when we are taking a care of tuberculosis patient. Educator, socialist, treatment supporter, nutritionalist, and an advocate.
I think you've summed it up very, very well, the role of the nurse that we, I think WHO or global guidelines come and like, oh, now we have to talk about mental health. Now we need to include nutrition. Now we need to do other things. And I always say, this is what nurses do. This is what we're already doing. We see the whole patient, the substance abuse, the lack of food security, poor nutrition, that we're mental health, providing that support. So as nurses, we're treating the whole patient already, but it tends to get put into silos by the larger organizations that aren't on the ground, that we're usually not a part of. But thank you very much. That was lovely. You said it perfectly. And Jojo, over to you, and then our honorary nurse.
All right, thank you so much, Carrie. Yes, like Shruti said, nurses play multiple roles, and not least of those is management. Because when you talk about the TB corner, there's making sure you order stock, you keep inventory, account for inventory. Not only that, there's also the mentorship part, where, like, for example, we have a lot of volunteers. You find in some clinics, you can even have up to 33 volunteers in one facility, community volunteers. The nurse has the role of supervising all those, making sure contact tracing is done, making sure they go out into the community. So nurses have a lot of roles. And another thing I've noticed, I think I should just mention this, and it's very important for nurses because healthcare workers are identified as high-risk groups for TB. So since we have received 1 HP, I've seen a good development. A lot of nurses in the TB corners have been taking it. They were shunning INH because of the 6 months. But with the 1 month, where you find that a lot of them have actually been taking TPT. And I think that's very important. That's a message I want TB nurses to take from this meeting. Like Elias was saying, TB infection, TB disease is more of a challenge than TB infection, so we can handle that with TPT. I think most of the things my colleagues have already mentioned, so I think I'll end there. Thank you.
Thank you so much, Jojo, and very well said. And Maria, over to you as our honorary nurse for today.
I think if I could add anything, it's that history matters. If we are going to move forward and make the leaps that need to be made to eradicate tuberculosis, and I always say it's such a strange thing that you can use cure and disease in the same sentence, and yet here we are with 1.6 million people dying and TB being the #1 global infectious disease. So I think if people can understand history and look at the history of tuberculosis, and not just that these nurses were on the front lines to find a cure, but what one of the most triumphant parts of the story is not just that these nurses were sent to this hospital because they also believed, the city believed they were expendable and they didn't die, and they were on the front lines of this galvanizing moment in history. But when we look at the story of isoniazid, it was unpatentable. The drug was affordable, accessible, and it closed Seaview down in 8 years. And Dr. Robacek had said, he didn't believe anyone should capitalize off disease, particularly tuberculosis. And his son told me, my father was just as excited to find something that cured TB as he was that the drug was not patentable, that companies were not going to make millions of dollars and gatekeep it, and therefore make it unaffordable for the people who needed it most and inaccessible. So for me, if people can look back at that time and say, we need to move towards a more equitable and accessible and affordable treatment plan for everyone involved, that would be my hope in the movement to eradicate a disease that does have a cure, because it is just almost hammers on the walls of logic to say TB has a cure, but over 1.5 million people a year are dying. I mean, that's almost like shameful. It's somebody, said to me recently, is that really true? And then you go into the explanations of why. So that's all I really want to add. And I just want to thank all the people who do work on the front lines and doing this work. It's extraordinary. And thank you. And happy Nurses Week. And I hope you're celebrated more than just this week, but all the time, especially because I'm not a nurse and you all take care of people like me. So thank you.
Thank you. And there's one question in the chat from Lillian Hamonga. Is it possible to run adverts on social, good presentation. Just a quick question. How best can we educate communities? Is it possible to run adverts on social media and showcase all of the work that's being done? And that would be, I think that's definitely possible, and would be wonderful to do so. Fernando, any last comments from you? We're now, I see, Petra, that we're at the hour. And if we need to close, we can.
Thank you, Carrie.
Just briefly, Fernando.
Yeah, thank you. I will be very brief. Thank you very much for the all organization, the all panelists, of course, the all audience that is here hearing us. It promoted our voice that Jojo mentioned, Shutri mentioned, so we need it. I truly believe that nurses are the key pieces for the health workforce in all health systems worldwide. We need to really show and literally express what does it mean to be a nurse. Only us know about our autonomy. Only us know the perspective and the responsibility, how to manage this care, how to proceed the nursing process and in what step pertain of cascade of care, not only in TB care, but I express it in a very wide main meaning of the care. So just to 1 minute to highlight, all of you are expressed. We have this situation in many states in Brazil, the lack of voice. We need spaces. We need to understand locally, culturally, barriers and how to lead it, about to avert any kind of negative process. So a group of nurses decide to found a network, a Brazilian network for the Brazil free of tuberculosis. We have in going to our fourth years to conduct part of the gaps all of you mentioned here. So the main mission of the Rede TB is exactly it, to give voice not to nurses, but the whole team of nurses. They share their experience. We motivate them to publish, to circulate the information. We are giving support for this mediation. We motivate each other and provide support of the speech. We give a strategy. We discuss a strategy to reinforce the role of Brazilian nurses. And we are doing exactly step by step, bring this perspective to the NAPS working group. So our group, Niji and Amanda and I, and all of we are integrated the NAPS working group subsection in the union. We are provided a space to debate it, even if you are not associated to the union. It will be not a problem of it. We are willing to discuss abroad how to connect better issues for TB care and mainly of the pivotal role of nurses worldwide. So please, my suggestion is to connect with your peers. Why not to found or to improve even a small movement, national network in your country. So it give highlight for nurses. We presented our TB nursing network in Brazil in our federal board of nurses. We connected local board of nurses with TB coordination municipality, TB state program to connect it, and we have an entry in our national TB program. So I'm very happy for this achievement. It's not enough. We know and we understand it's still some barriers to make this wheel run fast. We're still in a very slow pace, and we have to enjoy and we have to make connection. And to finalize my speech, yesterday we had a nice presentation from the PAHO perspective, the Pan American Health Organization, affiliate of the World Health Organization. And it was launched from the Dr. Pamela Cipriano, the president of the International Council of Nurses, to debate of the theme of International Nurse Day. Our nurses, our future, the economic power of care. So we have value. We can modify perspective and make intervention in a very profound perspective in the systems. So please, we are willing to change it. That's the reason we connect us. Fantastic that we have this connection as a co-host with the TBPPM group. Thank you very much, Petra, and the whole team of McGill Center TB. And Carrie, thank you very much for all the enlace that you have provided us for the last 10 years, at least that I know you. So good job. Let's keeping and moving forward. Thank you very much.
Thank you, Fernando. You're really setting the right example with what you're doing in Brazil. Fantastic work, and really happy that you're now, as part of the union, offering that platform for all nurses. So please all reach out to Fernando. We will make sure Fernando, put your email in the chat so people can find you directly, or the contact point to the NAPS. So please reach out. I'm very impressed with all the voices that I've heard today, and happy that we could give some voice, some platform for the voice of nurses. Thank you, Carrie, for wonderful moderation. Maria, as honorary nurse, very happy. We will help promote your book, and I love it. I have it here next to me. I'm in the middle of it. I can totally recommend it to anyone. And honestly, my big thank you goes to Elias, Jojo, and Shruti. You're the ones that are doing the hard work at the front lines, so you should be mentioned first. I really appreciate you taking time for speaking to the audience and for lending your voice and showing us the important work that you do to care for people that are affected by TB. And any of the nurses that are part of this forum today, my warm heart goes to all of you. Thank you for your fantastic work that you do, and please keep it up. If we can support you in any way, do reach out. I have a quick poll to launch, so to get feedback from anyone who is interested, please let us know a few questions and some answers that would be really helpful for us to take our work forward. We will put this recording online. It is actually already online. We will distribute it widely. There will be a short report, and we will also have an online forum where you can continue to discuss this important topic. Thanks everyone for your participation today, and really appreciate all of you here today on this Friday. Wishing you a fantastic rest of the Friday, and see you soon. Bye-bye. Thank you.
Bye. Thank you.
Thanks,
Happy
everyone.
Nurses Day.
Happy Nurses Day.
Bye-bye. Yes, happy Nurses Day. Have a nice weekend. Take
Happy
care.
Nurses
Bye.
Day.
Happy Nurses Day. Thank you.